So, Doc, let's discuss mental wellness. How can one cope emotionally and mentally with COVID-19?
So we do know that mental and emotional wellness are going to be around here for a long time. And in terms of even once we're over this virus, the long-term mental and emotional effects, both in adults and in children and in teens, it's going to carry on for a long time, right? And I think it's all very well for us to treat the disease because we understand to an extent, we understand the disease, we understand what we treat it. The difficulty here in treating is, as you had mentioned, is the emotional wellness. In terms of, we've just taken a whole country of people who've lived a certain way of life and we've locked them up for a period of time. And now we've said you can go out into the population, but you've got to do certain, you've got to put in certain factors. Some people can go out, some can't. In addition, we've overlaid onto that the anxiety of getting COVID-19, and there's a lot of anxieties. So the first thing that I would suggest, I think it's very important to talk about it. Don't bottle it up. Adults should speak about it. Adults should speak about it with their children. Parents should speak about their children, with their parents, grandparents. Everyone should talk about it. We shouldn't pretend it's not there. It should be a kind of discussion point, and we should put it out there. That's the first point. Let's don't pretend or bottle up anything. The second thing is that we should look out for support groups. So children would obviously look at their parents for support, and parents and adults should, and there are a lot of support groups. Once again, if you contacted that toll-free centre number that I gave, that's 0800 029 999 or covid.org.za. There are a lot of support groups on those websites that individuals can reach out to that are providing that emotional support for anxiety, and support for actually more severe mental diseases. And let's make no mistake, it's a period of high anxiety within the population. So those people who actually had a general level of high anxiety, this has pushed them over the edge. And even those people who never had anxiety suddenly are starting experiencing anxiety, and that's normal. You don't have to be worried that suddenly, am I normal now that I'm feeling anxious? That's fine. But the important point, as I said, is to speak about it, to reach out to your family members, to reach out to community support areas. And also, if you're feeling that you aren't managing, etc., then you should reach out to medical professionals, both either GPs or specialists, psychologists or psychiatrists, and talk about it. And in those ways, hopefully that we can start dealing with it within the population.
And Doc, what can I do to keep myself busy, while I'm cooped up at home and self-isolating? What sort of tips or advice would you give someone dealing with COVID-19? Okay,
so I first want to emphasize, as when we start off this discussion, we should not, it's a manageable, it's a pandemic that's going through the population, but we shouldn't be so fearful not to carry on our normal lives, in the normal way that we now need to obviously go out there. So we shouldn't be stop functioning. We should look as best to have a positive attitude, and we will get through this. It's a hard time of high anxiety, but our attitudes are actually, and I've seen a lot of studies done on this, that we should be waking up every day with a positive attitude. It's not a death sentence, right? We will get through it. There are ways of managing it, and we're doing as best as we can. So one, positive attitude. Secondly, what I'd say is that from a physical well-being, and there's studies to show this, and a lot of literature put on that, if you are fit and healthy, you're much better chance of actually fighting the virus if you do it. So you shouldn't be lying in your bed all day doing your Zoom interviews. You should be getting up. You should be walking around the house. You should be doing stuff. You should be going for your exercise sessions. We know gyms are closed, but there are many other ways to either do exercise at home or in the road or run. We should be keeping fit and healthy on two bases. One, it actually creates a healthy mind, healthy body, healthy mind, right? And the second thing, as I said, the fit and healthy you are, if you should get COVID-19, then you actually got a better chance of fighting it. There's no doubt that's been shown that people are fitter and healthier have a much better outcome than actually than those who don't in terms of fighting the virus. So we've spoken about your attitude, we've spoken about being fit and healthy, and then there's obviously the emotional side, right? And as I said to you, the emotional side comes about chatting to your family and members about it. We know that at this stage, we still can't socialize with our extended family, but even within our local nuclear family, we should be having the interactions that we can, obviously, to keep our emotional beings well. Then we should also we should also reaching out to support groups if we need to. And then, as I said, if you feel you're not managing it, then you should be reaching out to your doctors or your medical practitioners or the various assistance sites that are available on the internet and web. But it's not all doom and gloom, and I get the sense that there is a general sense of apathy, of negativism in the population, and we should try and work against that. Be positive, go out there, put the correct mitigations in place, do what the healthcare professionals, what the government, what your work advisors, and tackle each day with a positive attitude and approach.